Hi everyone, my name's Rena and I'm going to be sharing just a few tips for your first year in practice. I graduated from Barts in London in 2011 and thereafter went to do my DF1 at MK Bassett and Associates. I completed my DF2 at Guy's Hospital in restorative and oral surgery. During DF2 I also worked part-time on alternate Saturdays. Currently I'm completing a part-time specialty training program in periodontology and continue to work part-time at Woodford Dental Care and also now Pure Periodontics. The stress of final exams, case presentations and interviews is now behind you, and the thought of telling people that you're an actual dentist seems like a sweet ideal. Then suddenly, you're facing a long list of patients on your first day in practice. All of a sudden, you wish you were back at university. The comfort zone has disappeared. But don't panic. In truth, it's not so bad. It's just the fear of the unknown. You can do it, and you can do it very well. The point of this presentation is to give you just a few tips on how you can make your first year of practice a happy and productive one. Be confident in yourself. One of the scariest things about starting in practice is being given the reins to do what you want with your patients. Not having someone peer over your shoulder constantly can feel great, but can also be a daunting thought that you have to start making decisions for yourself. Your confidence will slowly build up as you generally do more work in the first few weeks of practice than you've done during the whole of dental school. However, try to be confident from the start, have faith in what you've been taught as an undergraduate, and always remember to keep the patient's best interests at heart. At the same time, it is also imperative that you ask for help when you need it. Don't be afraid to call your trainer over for a second opinion or discuss cases with any other colleagues. The more you discuss issues with the people around you, the more you'll begin to realise that there are plenty more people in the same boat. When help is available, push yourself to try things you normally wouldn't, and that could be anything from rotary endo to surgical extractions. That's the only way you'll begin to feel more comfortable. If there is no one around to ask for help, don't dive into anything that would be unsafe if it went wrong. Just postpone it. During our undergraduate years, we spend plenty of time and effort making impeccable notes. When under time restraints in a busy NHS practice, it is very easy to start picking up bad habits. However, it is very important to spend time discussing treatment plans with your patient and maintaining your record-keeping skills. Time spent discussing treatment plans, risks, options, costs may seem like time wasted not doing dentistry. It never is. Time spent on detailed notes may save hours of stress and possibly a legal case if your patient is not satisfied. We're now living in a very litigious society, and if any claims are made against you, the first thing that we looked at are your notes. If it is not documented, it didn't happen.
Hello, I'm Dr. Chris. How are you doing this morning?
I don't like dentists.
I understand, but we are a very caring dental office and we're here to make sure you have a comfortable experience.
I don't care. I don't want to be here.
I understand, but we're just gonna do an exam today. No pain, I promise. First, we'll start off with some x-rays.
I don't need x-rays. X-rays give you cancer.
I promise you, the radiation is so low, it's not a danger to you.
I don't care. No x-rays.
But we need them to accurately diagnose your oral condition and see if you have any cavities.
I don't want x-rays. I want white teeth. Do you have Zoom whitening? I saw that on TV. I want whitening.
We can't do whitening until we've established that you have good oral health and your teeth don't have cavities.
I don't care. I want whitening.
I think you have other dental needs that need to be taken care of first.
I want to whiten my teeth.
I haven't even looked in your mouth yet, but I can see from here that you're missing over half your teeth.
I'm sure we've all experienced difficult patients like these, and if you haven't, you will. Go into any dental practice in the UK, and the clinician will always have examples of when people become difficult. The reasons for this are numerous and complex. One of the reasons may be anxiety. Further influences include unrealistic treatment and consumeristic expectations. Fueling this all the more is the belief that the patient, has the right to this treatment because they've paid their taxes. They are mortified when you advise them that the work can't be done because laboratory fees alone are more than the NHS will pay for. So the question here is what can be done to help? Good communication skills are crucial to a successful and stress-free relationship with your patients. Listen to what they are saying. Pay attention to the tone and inflection in their voice. Take your time and try to establish their expectations. These may need correcting if they are too high. Times are hard and patients' budgets are stretched, so be clear with patients about why costs vary for the same treatment, and explain the drawbacks of cutting costs in both time and materials. A Ferrari and Volvo are not the same, although both are cars. You understand the dental differences, patients don't. Treatment decisions need to be made jointly by you and the patient after a balanced discussion of possible outcomes. Get to know your patients. See your patient as an individual, not a set of teeth with a treatment plan. Loops. There are ergonomic and optical benefits to wearing loops. 60 to 80% of dentists experience chronic back and neck pain, with a contributing factor being poor posture. In order to keep the patient's mouth in focus, you must be at your loop's configured working distance, i.e. the distance between your eyes and the working side, which will be set to an ideal posture. In my opinion, the earlier you get loops, the better. This is because there is a clear learning curve to using them. You can get either through the lens or flip-up loops. I prefer through the lens as it provides a larger field of view and the loops are also much lighter. So which magnification? As you increase magnification, the learning curve becomes steeper and the field of view decreases. After trying out a few pairs of loops for a couple of weeks, I found 2.5 was much more comfortable starting level for me. But why not also get a light? It makes a huge amount of difference even for simple treatment, but especially endo. Once you've got these, you really won't be able to live without them. Take plenty of clinical photos. If you can, invest in a basic camera with a 100mm macro lens and a ring flash. If you're lucky, your practice might have one already that you can use. But try and take as many photos as possible, even if it's just simple shots, as it will be improving your photography skills. If you do get any interesting cases or complete treatment that you're proud of, make sure you take some photographs, as it will be great to add to your portfolio. A nurse is an invaluable member of the dental team and can make your job a lot more pleasant and less stressful. Involve your nurse, ask for their input, and offer training. Show your respect and value. Put in the effort, and you'll be more efficient and happier. Do you talk to the technician only on the phone and only when there is a problem? Go to the lab, meet your technicians. I can't stress enough that good communication with your technician can make a huge difference to the quality of your work. Go and see what the technician has to cope with and ask them to contact you if there is a problem with your work. Some technicians are even happy to come to the clinic to take a shade for more complex cases. Let your technicians know when they've done a good job. Don't miss the perio. Periodontal disease is painless until the patient complains that you didn't diagnose or treat it. Some of the highest settlements are to compensate patients who claim that they were not told that they had periodontal disease, or it wasn't appropriately treated, and the notes cannot prove otherwise. Get out the perio probe routinely, record the BPE scores, tell the patient what is going on, record it. BSP has published updated guidelines on the BPE. The main changes were that the use of the asterisk symbol should now only be used to denote the presence of a furcation, and that both the number code and the asterisk should be recorded for each sextant where furcation involvement is found. It is also imperative to remember that full probing depths are required for any sextants where code 3 is recorded. If a code 4 is present, full probing depth throughout the entire dentition is needed. It is also important to bear in mind that in cases of severe periodontal disease, it is much easier for patients to allege, after the event, that they would have preferred a referral for specialist care. The BSP has created guidelines for referrals, so make sure you have a read of these too. Beware of the occlusion. A good understanding of occlusion is essential to ensuring optimal dental health and successful treatment. However, most dentists would agree that the subject of occlusion is fraught with controversy and confusion. Try to understand it as much as possible and note down each patient's occlusion in basic terms. Beware of TMJD and tooth wear. The signs of tooth wear and their possible etiology need to be recorded, as well as managed accordingly. There is very little teaching as an undergraduate on how general practice really works, the management strategies that need to be in place, as well as protocols and requirements for the CQC. Take this year as an opportunity to find out more about all of this. if you would ever consider opening your own practice, developing this interest is all the more important. Keep on learning. Keep on training and maximize your learning to improve your skill set. Your BDS is just the first step in lifelong learning, so it shouldn't stop there. There are vast amounts of study groups, lectures, courses and conferences available, so there's plenty to choose from. The more you go to during your first year, the better idea you'll get of what interests you and what you enjoy the most. Thereafter, you may like to target courses depending on your interests or where you'd like to further develop yourself. It's also a wise idea to start making a spreadsheet with all the details of your CPD. This will make it very easy when it comes to declaring your CPD. Whilst we're on the topic of learning, make sure you get your MJDF or MFDS exam done as soon as possible. It really doesn't matter or make a huge difference which one you choose to do. Make a career plan. During your first year in practice, try to start getting a rough plan of where you'd like to be, say in 5 years' time. This plan may change along the way, and it's a good idea to keep your options open. But any career plan increases motivation and helps to manage your life better. You get to meet a range of people this year, so speak to as many people as possible and find out how they've achieved what they have, what drives them, and what do they find fulfilling about dentistry. Think ahead, consider the way dentistry is going, and plan accordingly. One of the first decisions you'll have to make is whether you'd like to do DF2 or not. There are a number of reasons why deaneries made a second year of foundation training available, but the main objective is to give young dentists a broader and relevant range of experience, which will enhance their skills. The training can provide exposure in areas of dentistry that foundation dentists wouldn't otherwise receive at this stage. One of the main advantages is the increased level of confidence that the second year of training gives young dentists in broader aspects of their professional career. This can be through gaining experience of oral surgery or restorative techniques in a hospital setting, or feeling more confident working with anxious patients or children by spending time in the community position. If you want to specialise in the future, DFY2 or an SHO post is important. There can also be a number of different DFY2 posts, so read the job description carefully to check the role gives you the experience you want. So are there any disadvantages of doing DFY2? You would hope that most potential employers see it as a positive, but there will always be some who prefer to take on an associate with more recent experience of working in general practice. If you are worried about this during DFY2, you can still work in practice on Saturdays, which might stand you in good stead for the following year. However, DFY2 is not for everyone, and if you're happy to develop in general practice without any further years in hospital or community, then there's nothing wrong with that. Network face-to-face. It's a digital era, and there's a temptation in our networked age to think professional relationships and ideas can be developed via email. On the contrary, I think creativity and productivity stem from face-to-face, often spontaneous interactions. Attending national and local meetings and social events is a great way to network and meet new people in our profession. And finally, enjoy yourself. It doesn't matter how much you love dentistry, you simply cannot survive on a diet of composites, crown preps and evidence-based practice. It doesn't work. Remember all those things you used to do at uni, sports, hobbies? Even if you didn't, now is a good time to start. Balance your life and your mind, and you'll feel a lot better when you get the chance to switch off and get away from your 9 to 5. I hope you found this short presentation useful. I'd be happy to help at any time. Thank you.
Allez, allez, hop, hop, hop. Macaro. La bobo. Mais macaroni, spaghetti, meatballs.